in July, the CDC came out with some guidance statements about both children in the schools and the requirements for people to wear masks if they've already been vaccinated. And immediately, I can't remember if it was 1 day or 2 days or 4 days after that guidance came out, the CDH adopted that guidance and sent it out to the public. And I was very concerned about that because to me, even though it was just a guidance and not a mandate, it appeared to the public as if it was a mandate from the CDC. And many businesses, schools, government entities in the state started looking at that guidance as if it was something that had come directly from the board. If you look at our bylaws and CDH bylaws, section 2 of CDH says that the duties of the members of the District Board of Health the District Board of Health shall have the control and policy setting functions of the district health agency operation. In section 13, the duties of the secretary to the board, the secretary has the function of suggesting courses of action or policy to the board for their action. And I know, and you know, Russ and I have talked about this. I don't want to be overly prescriptive in every single thing that the staff does at the board, but I think we're living in interesting times, and we're living in precarious times when, in my opinion, the CDC sometimes comes out with statements that are more politicized than they're science-based. And I think there should be a discussion at the board before some of these guidances come out. And I wanted to have this discussion amongst us so we can debate. Before I go into the 2 specific guidances that particular edict came out with, I just wonder if any members of the board have any thoughts or questions about the initial presentation, the initial thoughts that I've had on what we should be doing as a board.
Madam Chair, to some degree, I agree with Raúl in that there were some. My concern was a Facebook post that came out that was an endorsement of a position of the Boise City Mayor, which I know is in complete contrast with everyone basically in Elmore County. So I had a frustration level that Central District Health was endorsing a position of a mayor in Ada County. And so I understand the position that Raúl's posing it's a concern, because I don't know that I want my name on things that come from a Boise City mayor. And he's right. The impression is that the board is involved in these types of endorsements. My experience was just with the social media posting. My question is, and it's always been throughout my service to the board, is I'm a big believer in exactly what he was talking about on policy setting. And so I guess I feel uncomfortable addressing just COVID related, things. I think that there probably needs to be an overarching board policy about how things are endorsed or how things are posted. I did talk to Russ about whether there was a social media or a press release type policy of what goes out and how that's determined. And my understanding is there's no formal policy on how that goes. And so I think as part of this discussion, I think that it might be productive for the board to provide an actual policy on how these endorsements of whatever entity go out, rather than, as Raúl has already mentioned, being prescriptive on certain issues.
Thank you, Megan. Thoughts?
I don't know, Madam Chair, I guess my feeling all along, I think our big function, and I think we've done very well with it, is we discover an issue, whether it's COVID, whether it's an STD or an AIDS epidemic or whatever, and we get that information out to the public, and the public is forewarned to protect themselves. That to me is our job. And I know a lot of the heat that we took off last year was the fact that we mandated all these schools to do all these different treatments for kids, and we never did any of that. And we were kind of blamed for that whole process. We advised the schools, and it was up to the school and the school board to decide what to do, same as everybody else. But we caught a lot of heat for that because everybody thought that was coming from the health districts. And when the schools come to you and ask, what do you guys think we should do? And we give them suggestions, it's not mandated that they do that. But we have done everything we can to notify the public, which is our job, of the health crisis. And I think we've reached a point now where, because of the politicization and because of some of the crummy Facebook stuff that's gone out there, we're losing credibility, not only us, but the CDC and all that. And to me, I think we reached a point where we have told everybody knows about the virus, and you gotta let people control their lives and let the chips fall where they may. And we're seeing that now in this latest rise. 98% of the people that are in the hospital are unvaccinated. That was their choice, but we did our job here in the health board, letting everybody know that these are the things that you might want to think about doing. And I'm really proud of the fact that we did that. I think we did a great job.
I just think on this issue, especially on something like mask, suggesting that we have masks in schools and suggesting that we have masks, that a person who's vaccinated double mask, has to mask in public. Those are things that are not science-based. And I'm trying to figure out how, as a board, we can distinguish between certain guidances that are innocuous and these kind of guidances that do not appear to be science-based. And I just want to speak to the two specific guidances that came out from the CDC, so you maybe understand a little bit better where I'm coming from. Let's talk first about asking fully vaccinated people to mask up. If you remember, when that guidance came out, the public just went crazy because they thought, okay, these vaccines don't work. And I think one of our main goals as a board is to encourage people to actually take the shot, to actually take the vaccine. I don't think we should be mandating it, but I think we should be encouraging people. And the reality is that more than 99.99% of people fully vaccinated against COVID-19 have not had a breakthrough case resulting in hospitalization or death. And this is actually information coming out of the CDC itself at the same time that it came out with this guidance. As in more than 164 million people have been vaccinated. Fewer than 0.001% of those individuals have died, and fewer than 0.005% were hospitalized with COVID-19. About 3/4 of all reported breakthrough cases were among seniors 65 or older. So we are trying to encourage people to vaccinate, and yet the CDC comes out with a guidance that says that we have to wear a mask in public if we're vaccinated. I actually think that does the opposite of what our mission is. That actually discourages people, those who are unvaccinated, it discourages them from actually being vaccinated because they believe that the vaccines don't work. And I think that's something that should be up to, that before it comes out as a guidance from the CDH, we should have a discussion about that because we want to send the right message. When the CDC changed its mask guidance in late July to suggest the vaccine, and the worst problem with that specific guidance is that there was no data at the moment of the guidance that they published supporting that guidance. In fact, it was roundly criticized because they did not cite a single study supporting the guidance. Eventually, about a week or so later, it cited data from Provincetown, Massachusetts, alongside other studies which found vaccination doesn't totally stop transmission of the virus. But absent from most of the national discussion was the fact that according to available data, as we just discussed, breakthrough cases were still exceptionally rare, and vaccinated people still didn't transmit the virus nearly as much as the unvaccinated. So, and even that study was a small sample of just 127 infected individuals who were vaccinated, in addition to 84 partially or unvaccinated. So we're setting the guidance that most people, frankly, in the state see as policy for the state, based on a study from Massachusetts of 127 infected people, and other studies that haven't been peer reviewed or anything. I think that's something that we should discuss as a board before it comes out from CDH.
Raúl, can you hear me all right?
Yes, I can.
My only concern about it is if we start going in as a board, and I'm not saying it's not a good idea or a bad idea, but I'm concerned about our credibility. If we start going against what CDC is recommending, somewhere along the line, we're going to make a big mistake, and then we're going to lose our credibility. That's my concern. You guys all know we've gotten all kinds of studies on the emails and texts from different places all over the world, and try to read those and understand them is a little bit tough for this old cowboy. But to me, again, it comes back to here's the best science available at this time. Now, I know, for example, in our area up there last year, our kids did not wear masks in both schools, McCall and Cascade, and they got along just fine. But they did an alternating schedule, and they social distanced the kids. And the big issue was sports, because mom and dad and grandma and grandpa wanted to come to the basketball games and the football games, and that's where we got, I think, a lot of people sick. That was a tough one there, and so. At that time, that was the information we have. Now we know that this disease is not as serious for young people as it is for super seniors. And so we need to rethink some of that. But I want to just make sure that we don't lose our credibility by nitpicking what CDC says. And we're going to support this, but we're not going to support that. As always, this has always been a school board decision for every school in the state.
The CDH bylaws already say that it is up to the board to set the policy for the district health agency. And we need to maybe figure out how we further define that, what is policy and what is not policy. And maybe, this was a good first discussion, and we need to figure out how we do that, because I think the public is confused. The school boards, when they saw the CDH, they're being inundated with calls both ways, because they say, hey, the CDH just recommended this, why aren't you doing it? Or some people are on the other side and say, CDC's wrong, why are you even thinking about this? So we need to figure out how we set forth that policy, and we need to be a little bit more clear.
Chair.
Yes, Megan, go ahead.
Yeah, and I totally agree. I mean, we're being used as a tool, and it's not. There are people who are setting policy, making assumptions that we're making endorsements of policies, and I agree. It's a totally good point, and that's why I was talking earlier about, and I agree with Elle too, putting information out is great, but endorsing certain positions, we probably need to have an overarching policy about how we go about that.
And Chair, I think too, we need to use the people in this room that know what they're doing for specific items on policy. If we have a SCD or whatever, we need that person to come in and say, you know what, this policy CDC has doesn't really work for Idaho, or doesn't work for this case. I'm relying on their experience. I'm not a doctor. I have no idea how to handle some of this stuff. So, and that's always the way it's been on this board. Is they come to us, hey, we need to talk about this. We need to figure out how to solve it. And this is the solution. And listen to the experts. And maybe what we could do is put an item on the agenda every month to do a policy review or something that's come out, and then have those specific folks come in and tell us what they think we should do and what we shouldn't do. And then we can kind of design our own after that. But, the issue that I can see, so I've seen this happen a lot in local government, is the fact that everybody's trying to cover their butt as far as liability. If we make a decision that kids can wear masks to school, open it up, and then a bunch of kids get sick they're gonna come after us. They're gonna come after us not only on social media, but liability wise too. And it's really made it hard to play in the gray area, so to speak. You have to have such specific rules just so that if this fails, they can't come back and sue us. And it's in everything, planning and zoning and all that stuff. And it's gotten to the point where there's a little bit of rule for everything. And we need to get back and live a little more gray area into our lives. To let us make some of those decisions ourselves based on what our experts recommend.
So but Madam Chair, I just have a question for Russ. When do you always put out guidance from the CDC under your signature, or yeah, I guess that's the question. Do you always put out guidance from the CDC under your signature?
Chair.
Yes, Russ, go ahead.
Raúl, I actually don't put guidance out under my signature, other than if we do what we call a public health advisory, which is really a formal document. It's still an advisory, it's still a recommendation. So that's kind of that. We have 100 guidance documents out there, from STDs to wear your bicycle helmet, don't smoke. So then you have the advisories like we did for the harmful algal bloom on Cascade Reservoir, and that really is much more formal. The signature went on the orders of the board because I'm the secretary. So
follow up, Madam Chair.
Yes, go ahead.
So when you sent out this guidance document and then you sent out a follow-up, they were both from your email, and they were very strongly worded. Is that what you usually do with guidance from the CDC?
Madam Chair?
Yes, Russ.
Typically, the guidance goes out from the agency through press releases, through social media, and through our website. That's how we push guidance out. We also have staff we call liaisons, like when I introduced Gina Pinnell as our new division administrator, she'd be working with the schools. So when CDC comes out with guidance and they say K through 12, mask up when indoors, regardless of vaccination status, then we're going to share that with our school administrators throughout our health district. That's how the process usually works. So just thinking on the kind of the timing on this, school, for example, when CDC pushes that guidance out, let's say it came out tomorrow, do you want, we'll work this out with policy in the process, we'll think through it and come back to you with some suggestions. It's kind of pointless to wait for 2 months when the schools are waiting. So the schools are going to react based on Boise School District, for example, is more likely to react based on what CDC says. So if the board wants to weigh in on that and say, no, we don't agree with that, and staff here said, no, we're not comfortable with that, we'll just have to figure out the kind of the cadence and meeting frequency and special meetings and things like that. Because that's part of the deal, is we don't meet frequently enough. You meet 7 times a year, typically, to be able to respond to this. So absence of information, people are going to go to what information is published, which in this case would be published by the Centers for Disease Control, possibly by the Department of Health and Welfare. They typically adopt CDC guidance at some point in time. And again, some things are more important to be decided on in a timely fashion, certainly with the respiratory illness and what Lindsay shared with you and what Representative Langston shared. The hospitals are having trouble right now. We can't wait till October 15th to make those decisions. So we're going to give it some thought. We'll come up with a policy for you guys to consider that we think will be workable, but still be timely and efficient enough that we're actually having the impact that we want to have in the community.
Are we going to shackle some of your people by doing this policy? I mean, I don't know how to say this correctly, but what I don't want to do is put out the wrong information, because that's going to, like I say, it's going to destroy our credibility. To me, if one of your experts comes to us and say we need to do this before our next meeting next month, to me, that's a concern. We need to get together again as a board on an emergency situation and come together and talk about that. I don't know about a policy that said, you know what, we need to vet everything that you guys are gonna put out on. I don't think I wanna be in that position because we've been meeting every other day, so. There's some things I think maybe perhaps this would be policy just for the coronavirus, not all the other aspects that we do as a health district. I don't, just throwing out ideas there. Because it seems to be the coronavirus is the thing that's everybody's stirred about. Nobody cares about, we're not necessarily, shouldn't say that, but we have the STDs, we have all the other stuff handled pretty well, and I don't think we need to get into that policy. That's what I was trying to say.
Madam Chair.
Yes, Megan.
That's why I'm saying if you have an overarching policy that if it's local data, local statistics that you're press releasing, that's different than an endorsement. And again, to your point, you don't want to look like a fool. And CDC hasn't exactly been great on, you know, the information that they've been putting out too. They've been contradictory and everything else. So I think that might be the line you can walk of not endorsing necessarily other people, you know, and more of a, this is a statement by Central District Health. Because, I mean, we just had the presentation on what the numbers look like and what the hospital data is. And if you want to do, as Raúl mentioned earlier, promote vaccine use because they know that if you get the vaccine, you're much less likely to end up in the hospital. We have that data from the hospitals and it's transparent and you can see it. And it's one thing to release that as local data than it is to talk about double masking and all of these other things that are kind of in the periphery. So I think that might be a line that you can walk as far as policy review.
Madam Chair,
Yes,
and if we could speak to the difference between guidance and recommendation, because to me, guidance is sharing information or expertise, but recommendation is implying that I think you ought to do an action.
Right.
Kind of, so I think making that differentiation as we're asking for this would be.
That's a really good point, Jane, because, you know, in the beginning, we talked about when we started talking about mask mandates, and everybody missed the first part of the statement is that if you can't social distance, wear a mask. Everybody went right to, oh, I gotta wear a mask. We didn't sell that right, I guess, what I'm saying.
Russ? John, you comment?
Sure, Madam Chair. So heard the discussion, appreciate it. I think I have a pretty good understanding of where the board would like to go, and we'll put together policy based on the conversation and bring that back to the board as a draft for consideration at the next board meeting, which is October 15th.